Welcome to Dr. Mide Sharing Medical Knowledge. In today's video, we'll delve into the intricate world of inflammatory bowel disease, IBD, which includes Crohn's disease and ulcerative colitis. These chronic inflammatory diseases affect approximately 1.6 million Americans, including as many as 80,000 children. Given that most cases are diagnosed before the age of 35, IBD stands out as one of the most significant chronic diseases impacting children and adolescents. Understanding the immune system in IBD. The immune system is a complex network of cells and tissues designed to defend the body against infections. However, in the case of inflammatory diseases like IBD, the immune system malfunctions. Instead of targeting harmful invaders like viruses and bacteria, the body's antibodies and immune cells mistakenly attack its own healthy cells. Picture your immune system as a security team protecting your body. When a virus invades, the team identifies, neutralizes, and removes the threat, keeping you safe from illness. In an inflammatory disease, this security team mistakenly identifies your body's healthy cells as threats, leading to an attack on these cells. This inappropriate immune response results in chronic inflammation, significantly affecting a child's quality of life. IBD versus IBS. Understanding the difference. IBD is often confused with irritable bowel syndrome, IBS, due to the similarity in their names and symptoms. However, the two conditions are distinct and require different treatment approaches. While both IBD and IBS can cause abdominal pain and changes in bowel habits, IBD involves actual inflammation and damage to the gastrointestinal, GI tract, whereas IBS does not. Types of IBD in children. Crohn's disease. Crohn's disease is characterized by a chronic inflammatory process that can affect any part of the GI tract, from the mouth to the anus. This inflammation can extend through multiple layers of the intestinal wall and may appear in patches, affecting one area of the GI tract while leaving another area untouched. Ulcerative colitis. In contrast, ulcerative colitis involves continuous segments of inflammation in the large intestine and the rectum. This inflammation affects only the innermost layer of the intestinal wall. Both conditions are marked by periods of remission, where symptoms are minimal or absent, alternating with periods of flare-ups, where inflammatory symptoms are more pronounced. Signs and symptoms of IBD in children. The clinical signs of IBD can vary significantly from child to child. Common symptoms related to GI inflammation include abdominal pain, diarrhea, blood in the stool, urgent need to move bowels, weight loss. Additionally, some children may experience extra-intestinal symptoms, such as skin rashes, joint pain, fatigue, or fevers. Causes of IBD in children. The exact cause of IBD remains unclear, but research suggests it involves a complex interaction between genetic predisposition, environmental factors, and the immune system. Environmental antigens may directly cause inflammation or trigger the body's immune response, leading to persistent inflammation. Once the immune system in a child with IBD is activated, it may struggle to switch off, causing ongoing tissue damage and the associated symptoms of IBD. Therefore, a primary focus of medical therapy is to help regulate the immune system. Diagnosing IBD in children and adolescents. Diagnosing IBD involves a thorough health history, physical examination, and various tests, including blood work, stool samples, imaging studies, endoscopy and colonoscopy with biopsies. These tests help identify abnormalities such as anemia or low blood protein levels, locate areas of active inflammation, and rule out infections. Imaging studies like magnetic resonance enterography, ultrasound, and video capsule endoscopy provide detailed pictures of the small intestine. Endoscopy and colonoscopy offer comprehensive views of the digestive tract, aiding in diagnosis. Sometimes distinguishing between Crohn's disease and ulcerative colitis can be challenging. In such cases, a diagnosis of indeterminate colitis may be given. Treatment for IBD in children and adolescents. Treatment for IBD is tailored to each child, aiming to relieve symptoms, prevent flares, and achieve mucosal healing and remission. The ultimate goal is for the child to lead a normal life and reach their personal goals. Medication. Medication is a cornerstone of IBD treatment. There is no one-size-fits-all approach, as children respond differently to various medications. Some may require a combination of drugs. Intravenous infusion therapies are administered in state-of-the-art infusion centers. Nutritional therapy. Good nutrition is vital for healing. Nutritional therapy, often used alongside medical treatment, includes various options tailored to support the child's health. IBD dietitians work closely with families to ensure nutritional needs are met. Surgery. In cases where medication does not adequately control symptoms or complications arise, surgery may be necessary. Surgeons specializing in IBD are available to guide families through the surgical process. Life with IBD, emotional concerns and support. Living with IBD can be challenging for children and teens. Balancing school, activities, friendships, and family life with a chronic illness requires support. Each child and family copes with IBD differently, and emotional support is crucial. Inflammatory bowel disease in children is a complex and multifaceted condition requiring comprehensive care and support. At Dr. My Plus Sharing Medical Knowledge, we aim to provide you with the latest insights and resources to help manage and understand IBD. Don't forget to subscribe to our channel, like, and comment below to support our channel's development and stay updated on more great topics. Thank you for joining us today.